My name is Matthew Stein, and I'm an orthopedic surgeon with a subspecialization in both primary and revision hip and knee arthroplasty. I chose to subspecialize in adult reconstruction because it's a field that has a proven track record of improving patients' quality of life and returning them to a level of function that they find meaningful to them. I think of particular interest to me is the patient who has an unhappy joint replacement or a painful joint replacement. Sitting down with them in the office and figuring out why the joint hurts and really what about it hasn't met their expectations is really important to me. And I think that the most important thing is A, providing patients with a great outcome in the primary setting, of course, but then B, making sure that if they have a painful joint replacement, that we can also restore them to a quality of life and a state of function that they find to be good for them.